Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and I want to welcome you to the New Zion site. Today, I will be joined by Mayor McNamara of the City of Rockford, Chairman Shirelli from the County of Winnebago, Pastor Copeland of the New Zion Missionary Baptist Church, and Illinois National Guard Captain Unverscott. So as we welcome you to this new site, we are here to address the health equity issue and concern. The health equity concerns have been highlighted throughout this pandemic, with increased disease burdens on communities of color throughout the nation, Illinois, and right here in Winnebago County. 24% of all cases of COVID-19 were in African Americans, who only represent 12% of our population. They also were overrepresented 13% of all deaths in our county. 18% of cases were identified as Hispanic or Latino, again, an overrepresentation of the 11% of our population. And they too had disproportionate numbers of deaths. Age-adjusted case rates further reinforce that Black and brown populations in Winnebago County are disproportionately impacted, and they tend to be younger than our Caucasian populations. We are losing a generation. But it's not unique to COVID, but it's been further defined by COVID-19. Systemic issues that have created underlying conditions that place our community members of color at increased risk for poor health outcomes and increased disease burden. We've talked about these social determinants. Think about education, literacy, language, early childhood education, our K through 12 systems, vocational training, and higher education. Healthcare, access to care, health coverage and insurance, provider linguistic and cultural competency, and the quality of care. We talk about neighborhood and physical environment, housing, distress, the number of properties that require demolition, transportation issues and concerns, safety, parks, playgrounds, the walkability of a community, zip code and place matters, and access to clean water. We talk about economic stability in terms of employment, income, expenses. Food, we talk about hunger and access to healthy choices and options and being located in a food desert. And talking about community and social context, whether we're talking about social integration, support systems, community engagement, discrimination, and overall stress. And as you know, in Winnebago County, we've talked about the concept of trauma-informed community. So when we look toward addressing hesitancy in Black and brown communities, what does the research say? A survey conducted in part by the NAACP indicates that it's critical as healthcare providers that we acknowledge the deep historical traumas that have led to distrust in our healthcare systems, that we provide comprehensive information. The emergency use authorizations for all of our vaccines are posted, and it's important that every community resident read them. That we ask questions from trusted resources, healthcare professionals, talking to your primary care providers, personal testimony. Identify why you're being vaccinated and why you chose to vaccinate. Remembering that our social media and internet are not the source of all truths. Making sure that we use trusted resources information. As a healthcare provider, I must honestly respond to some of the questions. Is it going to hurt? Yes, it's going to hurt at the site of injection. Yes, you may experience fatigue, headaches, a temperature, joint pain. You may not feel so great after receiving this. We need to dispel the myths. No, we are not injecting people with DNA or RNA. We're not putting chips in people. And we need to address a real fear of needles, trypanophobia. Interestingly enough, it's estimated that 10% of the population has this fear. And I know people are reluctant to tell us, I'm afraid of getting a shot. But don't delay your COVID-19 vaccination because you're afraid. We are trained and prepared to be able to work with you. And we need to acknowledge not only the historical truth, but the fact that this is a novel virus. It's a new vaccine, and we are learning more and more every day. And providers of color will be participating with us in this vaccination effort. Our members of our physician community, our nurses, our pharmacists, our dentists, and others are stepping up to the plate to help us volunteer to address these concerns and issues. As of March 29th, the Illinois Department of Public Health is reporting that 6.5% of all vaccinations have been administered to Black or African Americans within our community. And remind you that I said that they were 12% of our population. We have to step up the rate of vaccinations. And 4.5% of all vaccines have been administered to Hispanic or Latino residents, who represent 11% of our population. As the saying goes, we have miles to go to close that bridge and close that gap. This site has been selected and established with input from trusted leaders to address vaccine hesitancy among our Black and brown communities. I remind everyone we need to register to vaccinate. Don't hesitate. Now is not the time. The variants are out there. We've been identified as a hotspot for a potential resurgence. Don't delay. Just a reminder that when we talk about this, that less than 6% of our population of African American have registered, and 7% have been completed by the Latino population. If assistance is needed, don't hesitate to reach out. Please contact the COVID-19 hotline at 815-319-6705 or email us covid19@wchd.org. There's a team of individuals on that call center who will help you navigate those systems, whether you're having trouble with your internet and having trouble answering the questions, or whether you don't have internet access, and we need to help you cross that digital divide. We are here to support you. And as kind of in closing, I always say that there are benefits to vaccination. You're part of the membership to protect yourself and your family from COVID-19, to be able to experience some of the freedoms and joys that allow you to get together with other vaccinated members of your household. And at the end of the day, side effects are less than those of those being hospitalized or on a ventilator. We need to vaccinate together as a community to protect each other. So numbers of new cases from Saturday to Monday, this is why the concern is at 136. And again, knowing no age boundaries, 3 to 77 years. While the recovery rate continues to be at 98%, and we have no new deaths to report, we have lost too many residents of our community and of our historical generations to this disease. Our pest positivity rate is climbing. It's now at 4%, and we have no new locations of concern. So as we are welcoming you to our new site, and we look at and with favor and optimism as we move forward on this, we have to continue our social mitigation strategies. We need to continue to wear our face coverings when outside of our home, even after we vaccinate. We have to maintain 6 feet of social distancing, limiting the contacts outside of your immediate household. Avoid non-essential travel. I know this is spring break and everyone feels the need to get away, but once again, travel increases the risk of transmission. Avoiding crowded indoor settings. Now is not the time. If you contract COVID and your contact tracer calls, please answer the phone. Help us to identify and protect others in the community. We also are going to be discussing with you monoclonal antibody treatment so that we can connect you with a provider in our community that can help prevent hospitalization if you're eligible. We need to safeguard those most at risk, and this includes our greatest generation, our grandparents, those with underlying medical conditions, and our infants and children who cannot yet be vaccinated. We need to protect those essential workers that have held us together throughout this pandemic. We need to increase our room air ventilation. It's a beautiful day to do that outside. We're beginning to finally see some benefits of living in this area. And today, the emphasis is on vaccinate. So be thoughtful and intentional about your Easter and Passover celebrations to prevent the transmission of COVID-19. And we welcome all who come to this house for vaccination, that we need to protect each other. We need to stand together as a community.